Welcome back to Healthy Living. We are back with Dr. McCall McDaniel. Dr. McCall McDaniel is a pediatric orthopedic surgeon, and she is also working at the Bone and Joint Clinic in Covington. And let's say that location one more time, 71211 Highway 21 in Covington. So, Dr. McDaniel, welcome. Thank you for coming.
Thank you for having me, Amy. I really appreciate being here.
Yeah. So, I know lots about you. I would love you to tell our viewing audience a little bit about yourself before we kind of start talking business.
Sure, absolutely. So I was born and raised here in Covington. I went to Covington High School. I then transferred over to Alabama for my undergraduate, and then went to LSU Medical School in New Orleans. Did my orthopedic residency at Tulane, and then went to University of Utah for my pediatric specialty.
Okay. So you also work at the Bone and Joint Clinic with Dr. Rock.
I do.
And the whole team there. But you are a pediatric orthopedic surgeon, so that's a little bit different, and it's just a wonderful specialty to have here on the North Shore in our backyard.
Absolutely. Before I came, most of the patients in that age group were having to travel to New Orleans or Baton Rouge to be seen, so it's great to offer that for them here at home.
Sure. And you also benefited from the Bone and Joint Clinic expansion. You were part of that discussion, I'm sure, from the ground up. And what are some things that you are realizing from this expansion, and how are you benefiting and your providers benefiting there?
Well, it gave us a great deal of space that we were lacking before, which was great. I probably, to be honest, benefited the most from this expansion because they put me in the back with all the pediatric patients. We have a separate entrance for those patients, which has been great. Makes it kind of streamlined to get in the clinic and get back into the exam room and then get x-rays done and your cast all in one visit right in the same place. And I've been able to expand how many patients I've been able to see, which has been great as well. So we're very excited about this space and glad that we have this to offer to the community.
Yeah. So when you, what would a patient, when they come to you, what can they expect kind of from your practice, and like what's your kind of care philosophy at the clinic?
So, you know, we try to make sure that we can take care of all the problems right there in clinic. X-rays right there readily available. You'll get your cast if you have a fracture right then and there, which has been great. Also, PT has just been added to our clinic, which is a wonderful expansion as well. So the patients come into the separate entrance, which is in the back of the clinic. They check in at the front desk. We room you as quickly as possible and try to get us X-rays as quickly as possible as well. We know time is of the essence. You know, parents have places they have to be and kids have to get back to school. And then our cast room is right there on site with a cast technician ready to go if a cast is what you need. And then, of course, you know, we try to make sure we tailor each care plan to the patient and what their issue is.
Okay. So we talked about the expansion a lot with Dr. Rock and just now with you. Let's just kind of discuss. I know that you and I have talked in the past about this corrective surgery you perform on scoliosis patients. Right. And I want you to talk about what is your team's approach and what's different about the way you do it?
So it's definitely a team approach from our standpoint. The patient comes in, gets evaluated in clinic, and if they have a curvature of the spine, commonly referred to as scoliosis, the vast majority of the scoliosis patients that I see are adolescent idiopathic scoliosis, which is the most common form. And also the majority of those patients that have it usually just require observation and encouragement over the course of their growth. So we see them regularly for scheduled visits for x-rays and monitoring to make sure the curvatures don't get out of control. A lot of the times we'll also have to talk about surgery if there is a high magnitude curve. And obviously surgery is a big deal for any patient, especially for a pediatric patient. So we try to make sure that we go over all the ins and outs of what surgery is and what to expect preoperatively and postoperatively with the patient in clinic. And what's great about what St. Tammany can offer is we have a well-oiled machine in the operating room now and on the floor. So we have a team-oriented approach to it. It's always the same team in the operating room, which is great, which makes everybody move smoothly throughout the whole process. We also have a wonderful team on the floor that's able to take care of the patients, both in the PICU and on the floor, which is also a great addition as well to taking care of a scoliosis patient. Making sure that the family's comfortable and that the patient is comfortable, and then we share, you know, care with both the critical care providers on the floor and myself, and of course our PA, Danielle Napover, who's also a great addition to the clinic. So we also offer in the operating room something that I think isn't everywhere else. It's called the O-arm. And the O-arm gives us a nice 3D picture of the spine, and we have instrumentation that we can use to navigate using that picture after we get it in the operating room to show us exactly where our hardware is being placed live on camera. We can watch it on the screen. It's a really great addition, and I think it's great for safety. You want to know where your screws are placed, when you're placing them. And then after all of our screws are in place, we also then take another picture on the O-arm to confirm that what we thought was happening live is what exactly has happened. So we make sure that we know where our screws are before we leave the operating room, which not everybody can say.
So lots of layers of protection.
Correct.
And follow-up, and like you said, a streamlined approach with the same team,
Yep.
the same routine every time.
Absolutely.
So
Absolutely.
very good peace of mind for the parent. So how common, I don't want to backtrack, but I do want to backtrack a little. It sounds like scoliosis is pretty common.
It's definitely something I see quite often in my clinic. The surgical curves are way less common, obviously, than the observation curves, but I see quite a few patients with scoliosis.
Okay. So what is the recovery time? Once you do your procedure, what's the estimated recovery time for a patient?
Estimated recovery time for someone going back to full activity, which would be, in my opinion, contact sports. Let's say if you're a football player and you're going to have this procedure, you'll be back on the field, hopefully, if all goes well, in 6 months.
Oh, okay. Good deal. Yeah. So, all right. So let's talk about football in spring and all the athletics. It's warm outside. Everybody's back at it. You know, we're walking, we're running, we're biking, we're doing all the things. I asked Dr. Rock this question, and he talked mostly about adults. I'm sure some of the same thing applies to children, but when it comes to children, what do you say to parents, coaches, children who can comprehend? How do you keep your bones safe during this time?
So we definitely need to work on a stretching protocol. So my baseball players, football players, all the athletes out there, certainly stretch before and after you get on the field. Practice and games, we don't really focus enough on stretching. I think that's absolutely necessary. We have a lot of baseball injuries from my overhead throwers. There's a whole protocol that you have to follow for shoulder and elbow care prior to throwing the ball. So a lot of times that's overlooked, so that can be something that can cause an injury for sure. And just for the kiddos out there on the playground and riding their bike, make sure you use all the protective equipment that you need. So just be careful out there. Wear helmets when you're on your bikes and your scooters. Listen to your mom and dad. Make sure you don't take unnecessary risks. But you know, that's part of being a kid. So we're there to take care of you if you need us.
Okay. And so when you talk about this protocol, the team directors should know that, the coaches.
Yes, yes. So it's definitely something that our physical therapists in the community are great at communicating with coaches, and I know that they love to discuss it with coaches as well that might not have an idea of what needs to be done. So I think that certainly getting in touch with even our physical therapy department to go over a throwing program and how to stretch before that is crucial to the health of the athlete.
So this is a question that as a mom I always had, and I always had to kind of call someone and ask them. I had a neighbor who was a nurse, luckily, but when you do get that little injury, say you think you sprained something or something like that, do you ice it or do you put hot? What do you do? What do you do immediately after, before I even call you?
Immediately after, you want to place ice, I think is the best option for it for sure. Ibuprofen, ice, rest it, elevate it. Obviously, if there's a deformity, we need to go to the ER.
Sure.
But most of the time at home, ice, elevation, and rest is the first step.
Okay, all right. So is there anything else you'd like to add? Anything at all?
No, I think we covered pretty much all of it. We're happy to take care of all of these patients in our new area, which is great. So just give us a call over at the Bone and Joint Clinic, and we're happy to hopefully meet all of your needs here on the North Shore.
Well, thank you once again so much for joining us, Dr.
Thank you for having me,
McDaniel.
Amy. I appreciate it.
This was a great discussion. So stay right there. We'll be right back with Mike McNeil.